For over a century, the physical exam has been the absolute cornerstone of bedside medicine. But in today's clinical environment, we have to ask, are our own unaided senses still enough? So today, we're going to dive into a really powerful argument for evolving our most fundamental diagnostic tool. And yeah, that quote right there, that's pretty much the whole point of what we're talking about today. It's a bold statement, for sure, but it gets right to the heart of a huge conversation happening in medicine. How do we augment our skills to meet the challenges of our complex modern patients? Okay, so here's the game plan. We're going to start by giving the traditional exam its due respect. But then we have to get real and dissect its inherent flaws. From there, we'll see how ultrasound steps in to directly fix those shortcomings, creating this amazing new synergy at the bedside. And finally, we'll make the case for why ultrasound isn't just some new toy. It's the actual evolution of the stethoscope itself. So before we start poking holes in the status quo, it's really important to establish some common ground. The physical exam is so much more than just a series of maneuvers, right? It's a foundational ritual in medicine. It's a practice that connects us to our history and, most importantly, right to our patients. These four pillars, you know the drill: looking, feeling, tapping, and listening. They have formed the absolute bedrock of clinical diagnosis for generations. It's a time-honored practice, it connects us to our patients, but we've got to ask the question, is this tradition, all by itself, still good enough? And that brings us to the uncomfortable part. Because while we honor the physical exam, as clinicians who are committed to evidence, we also have to be really honest about its limitations, especially when we're facing the complexities of modern medicine. Okay, so let's break this down because this is where it gets really interesting. First, the exam is subjective. My crackles might be your transmitted upper airway sounds. Its resolution is low. You can't hear a tiny pericardial effusion. Then you've got variability in training and patient factors like obesity that can make an exam almost useless. And on top of all that, you've got anatomical noise, the chaos of a busy ward, and the simple fact that early disease often has no physical signs at all. And here's the kicker. When we actually put our most cherished exam findings under the microscope of evidence-based medicine, their performance is often just fair. Not good, not excellent, just fair. It's a pretty sobering reality check on the diagnostic accuracy we sometimes think we have. So you really have to ask yourself, right, at the bedside, with patients who are sicker and more complex than ever, is fair really good enough for them? Is it good enough for us? This is where POCUS, point-of-care ultrasound, comes into the conversation. And it's not just another piece of tech. It's a direct, targeted solution to the very problems we just laid out. It's almost like adding a whole new, powerful sense. Let's just put these side by side. It makes it super clear. The physical exam gives us a subjective impression. Ultrasound, on the other hand, gives us objective, recordable visualization. We're literally moving from I think to I can see. And this is a perfect example. Instead of arguing about the quality of the lung sounds you're hearing, you can just look and see the classic B lines of pulmonary edema. The debate is over. You have a definitive answer right there. And it's the same exact story with volume status. We go from the notoriously difficult art of estimating jugular venous pressure to the science of measuring IVC dynamics and collapsibility. It's the difference between an educated guess and an actual physiologic measurement. I mean, just think about trying to percuss a subtle pleural effusion or palpate for a little bit of ascites. It's incredibly hard. With ultrasound, we stop guessing about fluid and we start seeing it, even down to just a few milliliters. Our hands and ears they can't do that. It's not possible. And what's more, ultrasound is still a rock-solid tool, even when the traditional exam falls apart. In a patient with obesity where everything is muffled, or you're in a chaotic, loud ED, the ultrasound probe just cuts right through all that noise and gives you a clear diagnostic window. Okay, and this next part is super, super important. This is not an argument to throw away our clinical skills. Not at all. This is about creating a powerful new synergy, using technology to enhance and amplify the clinical acumen we already have right there at the bedside. And this slide just shows that synergy in action. So picture this. You start with your classic skills. You palpate the abdomen, you find the point of maximal tenderness. That is pure clinical skill. But instead of stopping there, you immediately put the probe down and you visualize the anatomy underneath. And in seconds, you go from suspicion to diagnosis, confirming or refuting your hypothesis on the spot. And that right there, that integration, that's the real magic. This real-time loop of hypothesis, then visualization,
then confirmation, all happening right at the bedside? It's the perfect fusion of timeless clinical reasoning with powerful modern technology. It really does create a new kind of diagnostic superpower. And look, this isn't just theory. The data is there. POCUS is proven to significantly speed up diagnosis, enhance patient safety by guiding procedures, cut down on other imaging, and it even lets us have better conversations with our patients because we can literally show them what we're seeing. So, where does this all leave us? I think it's time we stop thinking about ultrasound as just another gadget or some separate imaging modality. We need to reframe it. It's the next logical step in our own evolution as clinicians. So, when you put it all together, ultrasound elevates the physical exam because it directly tackles those inherent sensory limitations we started with. It boosts our accuracy, it gives us real-time data, it demonstrably improves outcomes, and maybe most importantly, it brings the focus back to the bedside, making us more powerful and more confident than ever before. And I think this final thought really says it all. The ultrasound probe isn't here to replace the stethoscope on our shoulders, it's here to become the stethoscope in our hands. It's an essential extension of our senses, letting us see what we could once only guess at. And by doing that, it truly redefines what is possible in the art of bedside medicine.